Tirzepatide, glucose-dependent insulinotropic polypeptide (GIP), glucagon-like peptide GLP-1 receptor agonist, used as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus. We should also notice that it's not indicated for the use in patients with type 1 diabetes mellitus and used as an adjunct to a reduced calorie diet and increased physical activity for chronic weight management in adult patients with an initial BMI of more than 30 kilogram per meter square obesity or more than 27 kilogram per meter square overweight, in presence of one or more weight-related comorbid conditions such as cardiovascular disease, dyslipidemia, hypertension, obstructive sleep apnea, or type 2 diabetes mellitus. Significant adverse reactions: acute kidney injury, AKI, which sometimes requires dialysis, has been reported with glucagon-like peptide GLP-1 receptor agonists. According to the manufacturer, AKI occurred mostly in patients who experienced nausea, vomiting, diarrhea, or dehydration secondary to GLP-1 receptor agonists. Diabetic retinopathy was reported with Tirzepatide during the SURPASS-2 study, a clinical trial evaluating the safety and efficacy of Tirzepatide compared to semaglutide in patients with type 2 diabetes. Patients with a prior history of DR were excluded from this trial. Gallbladder disease and biliary tract disease, including biliary colic, cholelithiasis, cholecystitis, cholestasis, cholangitis, and cholecystectomy, have been reported with glucagon-like peptide 1 GLP-1 receptor agonists, including Tirzepatide. GIT effects, including abdominal pain, constipation, decreased appetite, diarrhea, dyspepsia, nausea, and vomit, have been reported with Tirzepatide. Symptoms may sometimes be severe. Gastrointestinal effects tend to occur during dose escalation and decrease over time, and may result in treatment discontinuation. Hypersensitivity reaction, including anaphylaxis and angioedema, hypoglycemia, and medullary thyroid carcinoma. In the early stages of drug development, thyroid C-cell tumors were noted to have developed during animal studies with Tirzepatide. It is unknown whether Tirzepatide causes thyroid C-cell tumors in humans, as the human relevance of Tirzepatide-induced rodent thyroid C-cell tumors has not been determined. Human cases of medullary thyroid carcinoma, or MTC, have been reported with glucagon-like peptide 1 GLP-1 receptor agonists, dulaglutide and liraglutide. Mechanism of action: Tirzepatide is a glucose-dependent insulinotropic polypeptide GIP receptor and glucagon-like peptide 1 GLP-1 receptor agonist that increases glucose-dependent insulin secretion and decreases inappropriate glucagon secretion, slows gastric emptying, and decreases food intake. 99% plasma albumin protein binding, 80% bioavailability, 5 days half-life, time to peak 8 to 72 hours. FDA approval date is May 13, 2022. Tirzepatide, US boxed warning, risk of thyroid C-cell tumors. In both male and female rats, Tirzepatide causes dose-dependent and treatment duration-dependent thyroid C-cell tumors at clinically relevant exposures. It is unknown whether Tirzepatide causes thyroid C-cell tumors, including medullary thyroid carcinoma (MTC), in humans as human relevance of Tirzepatide-induced rodent thyroid C-cell tumors has not been determined. Tirzepatide is contraindicated in patients with personal or family history of MTC or in patients with multiple endocrine neoplasia syndrome type 2, MEN2, with the use of Tirzepatide, and informs them of symptoms of thyroid tumors such as mass in the neck, dysphagia, dyspnea, persistent hoarseness. The FDA has been evaluating reports of suicidal thoughts or actions in patients treated with glucagon-like peptide 1 receptor agonists, GLP-1 RAS. A preliminary evaluation has not found evidence that the use of these medications causes suicidal thoughts or actions, but the FDA is continuing to investigate this issue. Patients shouldn't stop taking GLP-1 RAs without consulting their healthcare provider. HCPs should monitor for and advise patients using GLP-1 RAS to report new or worsening depression, suicidal thoughts, or any unusual changes in mood and behavior.